Hello, my name is Dawn Green. I'm a student at Spring Arbor University. This presentation is about dealing with health literacy and health promotion. Nearly half of the American adult population may have difficulties in acting on health information. This finding has been referred to as the health literacy epidemic. So our patients come to us with different levels of education or literacy, and they may not speak in the same language that we do. These issues can become barriers for when they are trying to understand information about their health. So what is health literacy then? It can be defined as the ability to obtain, process, and understand basic health information and services, to make appropriate health care decisions or act on health information, and lastly is the ability to access or navigate the healthcare system, which we all can agree can often be extremely complicated. So any client who does not read or write well, has trouble communicating or understanding verbal communications about health, speaks a different language, or has trouble understanding or using numbers could have a problem with health literacy. There are several governmental and regulatory body initiatives that address the need for a focus on health literacy in the American population. First of all, there's Healthy People 2030. It's one of the initiative's overreaching goals is to eliminate health disparities, achieve health equity, and attain health literacy in order to improve the health and well-being of all. As far as health literacy concerned, it emphasizes people's ability to use health information rather than just understand it. It focuses on the ability to make well-informed decisions rather than appropriate ones. It incorporates a public health perspective, and it acknowledges that organizations have a responsibility to address health literacy. Next, we have the Plain Writing Act of 2010. It was designed to make or require federal agencies to train staff and use plain language when they communicate with the public. Next, the National Action Plan to Improve Health Literacy. This plan is based on two core principles. The first is that all people have the right to health information that helps them make informed decisions. And secondly, health services should be delivered in ways that are easy to understand and that improve health, longevity, and quality of life. The Agency for Healthcare Research and Quality uses the buzzwords universal precautions when they talk about health literacy. This approach assumes that all patients may have difficulty comprehending health information and accessing health services, so it's always important to simplify and confirm comprehension for all patients so that the risk of miscommunication is minimized, to make the office environment and health system easier to navigate, and to support patients' efforts to improve their own health. The health literacy, as far as Joint Commission standards, they do not specifically use the term health literacy, but many of their requirements that they have incorporate health literacy issues into them, such as providing information in a manner that the patient can understand, patients using information to make care decisions, providing written information in plain language, patient engagement, and participation in care studies. And lastly, the Centers for Medicare and Medicaid Services. Like the Joint Commission, health literacy is woven throughout the requirements set forth by the agency. They offer a free toolkit on their website to assist healthcare professionals and organizations to address health literacy. So why is all this important? Patients with issues with health literacy or low health literacy often have chronic conditions that are not managed effectively because the patient doesn't understand enough about the disease process and what needs to occur in order to make sure that their disease is under control. They often take less advantage of preventative services. They can become a burden on health systems. They're more likely to be admitted to the hospital or emergency room for preventable reasons. Also, readmission rates are high for these individuals, and that makes it even more important for us to address health literacy. Interestingly, they often rate their own health as poor. Patients are more satisfied when they can understand more about their disease process and be involved in their care. And providers become less, I guess you would say, burnout because they have less frustration about patients that they may consider over time as just being non-compliant, when in fact they just don't understand the instructions that are given to them or their disease. So all of this leads to higher prices for the patient and for the society as a whole, and that's perhaps one of the biggest problems that we have today with health literacy. So the next question we must ask is, who is at risk? Patients with low health literacy often share key risk factors. We should pay particular attention to our patients who are older adults, who are in the lower income brackets of society. They may be unemployed. Often some of these have failed to complete high school. They may belong to a minority ethnic group. And they may have recently immigrated to the United States and have limited to no English proficiency. Research is an essential piece of the health literacy improvement process and effective public health practice. Just as with every aspect of our practice as future providers, it is essential that we keep up to date with new evidence-based research, be able to critique and evaluate the research, and integrate new research into our practice as we see fit. So for brevity, I chose to examine just one study that I found interesting as I was preparing for this assignment. Drug therapy problems are common in primary care, and they're often related to prescribing errors by clinicians, polypharmacy, and ineffective patient education. So medication reviews are necessary to identify any of these problems and to rectify them. At the end of this presentation, I'm going to provide a list of online resources that I found that I believe will be helpful when I begin my practice. And the one that I like the most is the Health Literacy Toolkit found on the Agency for Healthcare Research and Quality website. On this website, I found, or actually not on the website, I did find a review of a component of the website, which is the Brown Bag Medication Review Program. The toolkit includes an action plan for implementing what they call a brown bag medication review. A common practice is to ask the patient to bring all of their medications to each appointment to check for accuracy and aid in patient education. However, it is sometimes difficult to get the patients to do so. So the table or the diagram that I have presented here for you on this slide depicts the aspects or the components of the AHRQ's brown bag plan. And I'll let you take a look at that briefly while I continue discussing this research study. So with the research that I did take a look at, the study showed that after implementation of the brown bag plan, there was a threefold increase in the percentage of patients who brought their prescription medications, and there was a sixfold increase in the number of prescription medications brought to each office visit. And lastly, the study found that the percentage of reviews in which drug therapy problems were identified and medication regimens were revised doubled. As with all studies, the research should be carefully critiqued for accuracy and any problems with its design identified before implementing the factors. So I did have a few concerns about this study. First of all, the sample size of the study was small and only included a total of 86 patients that came from 2 different practices. And the data that was derived was based upon self-report from the patient and provider, which means the accuracy cannot be verified. Thirdly, the clinicians selected the patients from the study, and that means they may have selected patients who were easier to work with or who they considered to be more likely to bring their medications to their office visits. And lastly, the study found that even though the percentage of patients who brought their medications for review increased, it only increased up to 68.3% of all patients. And also, even though the patients were asked to bring their non-prescription medications to their visit, they only had 19.5% of the participants do so. But even so, with all the caveats that I just spoke about, I think that I will probably implement the brown bag plan into my practice. I feel that the benefits from implementing the practice are greater than the associated risk. So it brings us to the question, how will I personally apply this to my future practice as a nurse practitioner? First of all, I think the first step that I've taken is to be aware of the problem. Next, I will ask open-ended questions to address my patient's understanding of any written materials. I'll incorporate the teach-back method because it's a wonderful way to determine if a patient has understood my instructions and can repeat the information in their own words. Also, the showback approach is one that I intend to use. It's useful when teaching a patient to use any type of device or perform a particular task so that they can demonstrate its correct use and we can assess their understanding. Also, I want to continually remember that patients may be embarrassed to share that they can't read and to acknowledge that. And if the patient is not forthcoming, I did read one hint is maybe to hand them the written material if I'm going over something with them upside down, just like I'm doing it inadvertently. And if they don't turn it right side up, that may be a clue that they are having difficulty or they can't read. It's going to be important for me to use simple language and avoid complicated medical terminology, and to remember this when I'm talking and speaking with my patients. And sometimes it may be important for me to use graphics and pictures instead of long written instructions. Also, I intend to use some audiovisual aids or models, and a little later I'm going to be discussing some of the tools that I have found online that I found very useful, and I want to share with you guys and think that you may find them, hope that you may find them useful in your practice as well. Also, I'm going to need to make sure that I have educational materials or written materials in different languages that the patient may speak in, and also have access to language lines or video interpreters to make sure that the patient is understanding or what I'm trying to tell them, and that language barrier is not an issue or is less of an issue. Also want to make sure that my staff and myself are aware that we may need to help my patients or our patients complete forms if it looks like they're having difficulty, to take the initiative and just say, hey, can I help you with that? And help, especially with our elderly population. And lastly, I want to look out for and make a collection of any written material that I could give to my patient for common disease processes or issues that I know that I'll want to be discussing with my patients frequently. And something that I did read that came to mind just now is that this information needs to be written basically on about a 6th to 7th grade age level so that I'm able to hit all of my audiences that I'm trying to educate. In conclusion, I've listed some resources that I've found online while completing this assignment. I intend to use some of these in my practice, and I thought that they might be helpful for you guys as well. And this concludes my presentation. I hope you have a better understanding of why health literacy is such an important topic to understand for us all and for us to plan on addressing in our future practice as a nurse practitioner.